up to broader questions and discussions for the entire morning session. There are definitely some themes I noticed that go through the entire morning. Neuromodulation being one of them, non-invasive and invasive. So if anybody wants to ask questions for this session or the earlier sessions or raise topics for discussion, now is the time.
I can ask it down. Maybe it's a question for you. Just to get the discussion going. So, Andy, what I can answer this one. I'll try and answer the question myself as well. But what do you wish you had that engineers could help you with to sort of take the next step forward in the type of research that you're doing? Is it a new device? Is it recording? Is it simultaneous recording and simulation? Or what are the engineering challenges that you think face your area of neuromodulation and neurotechnology that you wish you could work on?
A really good question and a timely one because they're engineers here. So, no, I think there are a lot of toys that would be wonderful to have. I think the major one, and the one I think that is the most challenging to implement, is TMS MRI. There are a few places that are doing this, but and I've visited my colleagues. Mark George at MUSC has a robust operation set up doing TMS MRI, and several places do. But it's challenging to get that set, and certainly not unprecedented. And I think just in general, the integration of image processing and data processing across multiple domains. So the capacity to do MRI, EEG, but also one capacity which I wish we had at UCLA, MEG, to be able to look at the signal from multiple different domains. And MEG would have lots of potential. It would complement EEG very nicely in terms of being able to look at signal sources from a different standpoint. So I think that would be my wish list. But Marco,
Yeah, I actually comment on this. It's a great question. In fact, you briefly touched on it earlier. I've been reviewing for this brain interface, and I'm always the neuroscientist in the room, and there's plenty of engineers. And what's striking and almost depressing, to go through your thing, is that we don't have a common language. It's very difficult to establish a common way of thinking about solutions of problems. I think that's something that should be done. I don't know how it's going to, take, the challenge and say we're going to find, a think tank to actually solve the problem of having a common language between neuroscientists or clinicians and engineers. But I think that's, I noticed that a lot of applications have these really cool ideas, and I think that by just implementing the idea, you're going to solve all the problems of neurology and psychiatry, and that often is not the case. And so we need to establish a common culture so that we can be to have more fruitful collaborations.
Yeah. Since I switched from engineering to medicine, so actually personally, I take that it's a hard road and long. But I think right now I really enjoy when I go to end this seminar. Actually, I understand most of them. And the other thing is that if we have an engineer seminar, we have some doctor come in, and sometimes they get lost. So I believe that we need a kind of like a consortium that they can house the medical doctor and engineer together. And I believe if we have that one, then the doctor really can tell engineer the wish for list. And we are creative. So once you can tell us you are in the driver's seat, then we can bring the technology to help you. So I see a mechanism we should establish is that this kind of dialogue on the medicine side say, hey, I wish to have this stuff. And I think we engineer can immediately jump in. So it should be driver from the medicine instead of from the engineer. Engineer would be provide benefits to help.
I think you're right, but I think it goes the other way also, because sometimes, I can't recall a specific example, but where we met with engineers say, I've got this really cool device, I don't know what to do with it. Right? That happens. Engineers do that a lot. But sometimes, having the doctors or physicians or people involved in clinical medicine can shed light on how to use devices in ways that weren't intended. I think a very good example of that is, it didn't happen at UCLA, but it could have easily happened, and is Medtronic developed a device that they call PC plus S, which is a deep brain stimulator that can sense, and so sense signals while it's stimulating. And they originally intended it for applications for movement disorders. And when they made it available for researchers, it was only a small fraction of studies that actually used it for movement disorders. The vast majority of applications were beyond movement disorders, where it's being used for depression, for deep brain stimulation for depression, it's being used for Tourette's, it's been used for brain-computer interfaces, it's been used for many applications way beyond what the engineers who designed it had intended it for it to be. So I think it's a two-way dialogue. We need to hear as much from the engineers in terms of, I can do this, what can you do with it, as much as for us to say, we need this, can you help us develop it? I think it's I remember the first time we all met engineers and neuroscientists several years ago, and there was a disconnect. I think we've come a long way since several years ago, but I think there's still ongoing dialogue that is needed.
I'd like to reinforce a comment that Wentai made in my position as Associate Dean for Research in the School of Engineering. I think there is a real need to formalize the relationship between engineering and medicine. And our deans are talking about it, Dean Kelsey Martin and Dean Jayathy Murthy. But I think they could use some additional positive input, perhaps, from some of the people in this room. We already have very strong connections between engineering, medicine, and neurotechnology, obviously, but also in tissue engineering, wireless health and personalized medicine, human genomics, and using advances in hardware and software algorithms to analyze human genomes, another revolution, right, in medicine. It really should be a no-brainer that on this campus, where we have engineering and medicine within a 5-minute walk of one another, that we create a stronger link, some sort of engineering medicine or medicine and engineering institute. And we have space that's opening up, okay, to house such an institute. So here is a real opportunity to do something. And I think this campus also, we're number 1 or 2 in the country, a lot of you may not realize this, in startup companies. And I think if something like 80% of them are medically related, right? These companies involve technology as well as medicine. So there's huge possibilities on this campus. Neurotechnology should be right near the top of the list, right? The possibilities for engineering and medicine. So I encourage you all to get involved in encouraging something to happen there. Bringing the people together, our postdocs, PhD students in close proximity, that's what's really going to make it happen. When the people really doing the work in the lab start talking to each other more.
I'll add something to that, because this is really why we're doing this. So the first step is getting us all together. The second is getting over the imposter syndrome or the fear that you're not an expert in this other field, and asking those questions that you just some things you just don't understand. And we've done a lot of this. It's been a lot. I sit on committees for a handful of electrical engineering students, and most of that time I feel very much lost being a neuroscientist, but not being afraid to ask those questions. Well, what do you mean by this? Let's talk about it more. Let's say it in different ways so that I can understand it, you can understand it. So I would put this out to students and postdocs to speak up today, and ask those questions, feel comfortable. There's a lot of things we don't know, right? Because we're in completely different fields. And that's the first step, is beginning those conversations, getting over that fear, that, well, I don't understand really what he's talking about, so I can't ask a question because I'll look dumb. So that's the next step, is I want to push, students to really speak up today. And You're the ones that are going to make this happen. Go ask committee members who are not in your departments to sit on your committee and things like that, because you can. I think you have one to do that. So I'll add that to the list of wishes here. Anybody? Andy?
Yeah, I mean, just to add to that, you know, this is in the area of depression, which is where I do most of my work, this is a very highly motivated group of patients. They're eager to help try out new treatments and new devices. And I think that there's an increasing recognition that psychiatry is moving more toward being a procedurally based specialty. The acceptance of these kinds of interventions is growing in part because of the limits of medication, and in part because of the promise of these technologies. And I think to underline Nanthea's point, you know, many of us who are clinician scientists frequently feel like Luddites on the technology side when it comes to trying out these devices and trying to integrate some of these methods into clinical care, and would welcome collaborations on the from the engineering side of things, and the opportunity to try out some of these devices both to treat and to perform advanced measurement during treatment. So I think there's a lot of room for collaboration.
Yeah, I'm always thinking about how we can continue the dialogue on a continuous basis. So we put on our seminars, but as you were speaking, you know, you've got these engineering seminars, and I get every single announcement, and I never go. I wouldn't say I never go, but I rarely go. And ironically, even though we're only 5 minutes away, it's still sort of, you know, I'm a clinician and I've got everything else going on, it's still 5 minutes away. I mean, maybe one thing we should do is actually have the engineers come down here where it's convenient for us. That's how they think we are. And vice versa. I mean, I don't think the engineers are always coming down to hear medical talks, and so maybe we need to make a concerted effort to actually invert that.
Alternations.
Yeah.
Along these lines, years ago when, many of you don't remember, when Frank was on with Dean, he would have these sessions where whole clinical departments would come to the School of Engineering, and one person after the next would get up and just describe current problems. Some of them we could solve literally within a week, you know, for them. You know, plumbing issues and urology. You know, other things turned into really long-term, very fruitful collaborations. Ximing Ho's group and using MEMS developed new diagnostic tools that resulted in startup companies. So those sorts of interactions are very useful, and yeah, they can go either way. I mean, they can happen in the med school facilities or over in engineering. But also, I think key to it is professors are really busy people, which a lot of us travel a lot. Clinical practitioners, extraordinarily busy, right, with patients in addition to research. So I think a lot of what needs to happen is going to happen between postdocs and PhD students, and getting postdocs and PhD students in the same spaces, working together, and having areas where they can interact. That's a proven mechanism to facilitate stronger collaboration. So I really think we need to look into pursuing that. And there is space opening up.
We
tried. Dedicated to
with this new research tower, we proposed that something should be dedicated to neurotechnology.
Yeah.
It wasn't received.
Try again.
But we'll keep trying. Yeah.
I'm going to say the same thing, and as I mentioned earlier, I focused on the trainees. In my experience has been that the significant connection and advance in every case has been from a student that came from engineering and came to the lab. They became a part of my lab, and they also had a mentor in engineering or a technology type department, because it kind of, I learned pretty quickly that there are not very many professors that are working at 80% of their effort. And so when you ask them to collaborate, it's hard to get them. You can't do it unless you have money to support it and make it happen. But if you have a motivated student that has an idea and you can get them into your lab, it could, in my case, into a physiology lab, or one of the biology students go into engineering, they need to have 2 labs that are working on a common project. And this has been very successful even with Caltech. I've had fantastic graduate students from Caltech that have come to my lab and basically did their whole thesis, but the graduate students is the glue. It makes it happen. And so that's, if we could have scholarships or fellowships that would favor individuals that are trying to do this, that would be a big jump.
I think that's a great point. Let me make one last comment, then we'll break for lunch. The other area, and I'm biased, there's a lot of us in the room that are funded by the BRAIN initiative, which is a great opportunity. But every year it's called the BRAIN Investigators Meeting, but it's actually open to the public. And for those of you who are interested in it, it's every April. It's in Washington, D.C. Everyone who is BRAIN funded either gives a talk or has a poster. It's a great opportunity to walk around and see what's going on at the interface of neuroscience and neurotechnology. I go to a lot of meetings. It's probably one of the few meetings I actually find valuable and enjoyable and where I get new ideas. So I don't know if any other one, everyone else who's a BRAIN investigator can comment on it. It's a good meeting.
It's a heavy focus on neurotechnology, actually. It's like everywhere when you walk there. You walk into those poster sessions. There's neurotechnology everywhere. So it's very relevant for what we're trying to do as well. And then I'll add one more thing before lunch, sorry. This afternoon, please stick around because actually several of the trainees are going to give talks. So we have 3 postdocs who are going to give, female postdocs who are going to give talks this afternoon. I had to add that in there. And then at lunch, we have also emerging projects presenting from students, trainees, and faculty for projects that are developing now, so need feedback. So please stick around. We're very excited for the afternoon.